Good evening, and here we are. I've just straightened the beard, so it's a bit fuzzy. Right, so what I thought I would do is I'd do a live on the things you can and cannot do as of this Monday coming, basically, Monday the 19th of July, which happens to be Freedom Day. It's labelled Freedom Day. Now, why it's labelled Freedom Day, I've got absolutely no idea whatsoever, okay? I'll probably upload this onto YouTube, and call it Freedom Day. What I also thought I would do is I'd have a glass of wine while I'm doing my live. So we can either call it a wive, wine, live, or we can call it a line and wine. All right, so step 4 from Monday the 19th of July. You have to forgive me because I'm going to be looking at a computer as well. While cases are high and rising, everybody needs to continue to act carefully and remain cautious. This is why we are keeping in place key protections at step 4 from the 19th of July. So it's not really Freedom Day because you are still going to be limited to certain things you can and cannot do. So there's no freedom with this whatsoever. Testing when you have symptoms and targeted asymptomatic testing in education, high-risk workplaces, and to help people manage their personal risks. Okay, so asymptomatic. Now, if you're asymptomatic, this means that you have COVID, but you are not. You are producing any symptoms. There is no proof. There is no proof whatsoever that somebody who has COVID yet has no symptoms has passed on COVID. Why? Because nobody knows. Nobody will know if I have COVID and I pass on that COVID to somebody else. Nobody will know. Because I would be asymptomatic. So you don't know. There's no proof in symptomatic testing whatsoever. High-risk workplaces to help people manage their personal risk. So again, you've got to watch yourself in these places. Isolating when positive or when contacted by the NHS, test and trace. So again, you're not free. You still have to isolate. When the NHS have contacted you. So if you're using the app or whatever means you are doing, you still have to go through isolation. Now the thing with the isolation is, now I'll save that for another live. Yeah. Border quarantine for all arriving from red list countries and for those people not fully vaccinated arriving from amber list countries. So anybody who has arrived from these countries and is not fully vaccinated must quarantine. Now, if you are fully vaccinated, then that tells me that you don't have to go through the isolation and the quarantine period of 10 days, whatever it might be. So you don't have to add 10 days into your holiday. For the fully vaccinated, that's a bone of contention with me, but I'll get into that maybe another live. I might do another live tonight based on that. Depends how many glasses of wine I have during this live. Cautious guidance for individuals, businesses and the vulnerable whilst prevalence is high, including. Whilst government is no longer instructing people to work from home if they can, government would expect and recommend a gradual return over the summer. So you can go back to work in an office. However, they're not saying that you have to work from home, so you can go back to the office if you want to, but gradually. What that means, I've got no idea. That's something you have to sort with your employer. Government expects and recommends that people wear face coverings in crowded areas such as public transport. Okay, so they are not taking away the face coverings. They are expecting you to wear face coverings in these crowded areas. Now, these crowded areas could be public transport, it could be shopping centres, it could be supermarkets, that kind of thing. So the face coverings, etc., are still, as they would say, a mandatory thing, but apparently it's law. And it'll be law under the Coronavirus Act of 2020. Being outside or letting fresh air in. So does that mean you're allowed to be outside and you're allowed to let fresh air in? Who's not going out? Who's not letting fresh air in? Minimising the number, proximity and duration of social contacts. So you are now going to have to watch yourself and you are limited to the amount of people that you are in close contact with, and also the amount of time you are in close contact with these people. The government is basically leaving this up to the individual. They're leaving this up to people's discretion. Okay. Encouraging and supporting businesses and large events to use the NHS COVID pass in high-risk settings. Aha! So, here's the passport. Here's the passport, I'm assuming. The government will work with organisations where people are likely to be in close proximity to others outside their household to encourage the use of this. If sufficient measures are not taken to limit infection, the government will consider mandating certification in certain venues at a later date. Right, so there's the preempt. Basically what they're saying there is if the measures that are put in place, so again, this Freedom Day, that's not really a Freedom Day, if the measures that are put in place are not sufficient enough, then they will bring in the passport. So that in that statement there, the government will consider mandating certification in certain venues at a later date. They're already saying they're going to do it. They're going to bring in the COVID passport, okay? You are going to get that COVID passport. I'm going to throw it in now. Okay, so the COVID passport is a bit of a mockery, really, because I know of people, again, I'm not going to mention names, I'm not going to mention things that might spark these people's names. However, I know for a fact that there's people out there that have been double jabbed and have also contracted COVID. Now, just because you've been double spiked doesn't mean to say you cannot contract or transmit COVID, okay? Because you can, and people are doing. Okay, so for example, if I go to if I know of somebody who's been double spiked and has contracted COVID, they then have the audacity to say to me, "Have you got a passport to enter my premises?" That there in itself is it's a dilemma for that person, because they can't have the damn cheek to say to me, "You've not been vaccinated, I've also not had COVID, but yet you need to prove to me that you've been double spiked before you enter my premises, but yet I've had COVID and I've also been double spiked and I've also had COVID again." Do you know what I mean? So this double spiking, it's not 100% working. Yes, you don't get, apparently from what I'm told, is you don't get as ill from this if you've been double spiked, but still it's a contradiction, isn't it? You go to a restaurant, for example, and you know the manager at that restaurant has been double vaccinated, had both jabs as recommended by the government, but after that has also contracted COVID-19, and then has the audacity to say to you, "You can't come in here because you've not had the double jab and you've not got a passport." Well, hang on a second. No, I haven't. I've also not had COVID. I've also not had to self-isolate at all. Okay? So touching wood, I won't get COVID. Touching wood, based on things, I should have had it by now. I've got breathing issues. I've not social distanced. I've never worn a mask. And I don't sort of abide by those rules. Purely because the mask wearing. It's not because I'm being rebellious. It's because I'm exempt. I'm medically exempt from mask wearing. Causes me distress. But I've never contracted COVID. Now I don't know if I've transmitted it because I may be asymptomatic. However, you can't prove that unless I get tested. And again, the PCR test isn't as accurate as people are saying. Even the guy that invented the PCR test has said it's not meant to be tested for COVID-19. So that's how the rules have changed on June 21st. All right, so basically, the rules on weddings and civil partnership ceremonies, wedding receptions and civil partnership celebrations changed on 21st. Basically, there's no limit to this now. So there will be no limit, I don't believe. It's not in here. Large event pilots. Now here's what they've been doing. A limited series of pilot events will take place to produce additional evidence on reopening events safely. Attendees will need to show proof of vaccination or a recent negative test. This will include some UEFA Euro 2020 matches, 2021, at Wembley, and a small number of other sports, arts and music performances. The full list of pilots and further details about the events will be announced shortly. So what they've done, this is what they've done is they've actually put these pilot events on, and it was part of an experiment basically. So any gatherings that have been able to happen, whether it be, like it says, sports, arts, music and performance, anything that's been on where we say, well, hang on a minute, how can you have 40,000 people in a stadium? That's been a test. Now, the only one that I know of, that I know have been reported, was where they had a huge party indoors. 60,000 people attended these events, and only 15 tested positive for COVID. Okay, so that's 60,000, only 15 have tested positive for COVID. Now, whether that's 15 people that actually went for a test, or whether that's that's all 60,000 that actually took a test. If you are in an area where a new COVID variant known as Delta is spreading, right, so there's a list on the government website. There's a list on the government website where the new variants are spreading. I don't want to go on to that. What have I done? Hey, what have I done, man? Totally messed this up. Gov.uk. So this is all from the government website. Search gov.uk. I don't know how I came off it. Rules from 19th of July. There we go. Search. Coronavirus restriction, what you can and cannot do. Here we are. So I've read that out, I've gone through that. Large events. There's a list of places where the COVID-19 variant Delta is spreading. Bedford Borough Council, Birmingham City Council, Blackburn and Darwin Borough Council, Blackpool Council, Cheshire East Council, Brighton and Hove City Council, Cheshire West and Cheshire Council, Greater Manchester Combined Authority, Bolton, Bury, Manchester, Oldham, Rochdale, Salford, Stockport, Tameside, Trafford, Wigan, Lancashire Council County in Burnley, Chorley, Fylde, 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 Haydenburn, Lancaster, Pendle, Preston, Ribley Valley. That sounds like a nice place, doesn't it? Ribley Valley. Rosendale, South Ribble. South Ribble. That sounds like a nice place as well. I'm being told they are. West Lancashire and the Weir. Liverpool City Region Combined Authorities, Halton, Knowsley, Liverpool, Sefton, St Helens and the Wirral. Oxford City Council and Warrington Borough Council. So they're places where the COVID-19 variant is spreading. So if you live in those places, chances are there's going to be another lockdown for you. The new COVID-19 variant known as Delta spreads more easily than the variants that were previously most common. To stop the spread, you should get both doses of the vaccine when it's offered. And encourage others to do so as well. So now they want us to promote their vaccine. A vaccine that needs this much publication isn't a vaccine anymore. Okay, it shouldn't need this much. I've been watching a load of videos on YouTube of vaccine sites, and I don't understand this. Why a vaccine site needs security? Why a vaccine site needs so much you're not allowed to film these, and it's like I don't understand why I'm not allowed to film. These people that are going out there, and why they're not allowed to film. But yes, so it's just said there, the new COVID-19 variant spreads more easily than the other variants that were previously most common. To stop the spread, you should get both doses of the vaccine. Now, just because you've had both doses doesn't mean to say you're not going to catch it, because you can. Just because you've had both doses doesn't mean to say you will not pass it on, because you can. Participate in surge testing in your local area where you are vaccinated, whether you are vaccinated or not. Okay, so if I want to book in for a test, I have to go masked up, which I won't do because I'm exempt, so I won't even be able to get tested, unless I go for a drive-through. It's like McDonald's, isn't it? The McDonald's vaccine. And I also have to have symptoms. But then if they say you got symptoms, don't go get tested, because so you can't win. You can't really win. Self-isolate immediately if you have any symptoms of COVID-19. A high temperature, a new continuous cough, or loss or change in your sense or smell of taste. If you have not tested positive for COVID-19. So those things we all know anyway. The next thing is, in the areas listed above, you should take particular caution when meeting anyone outside your household or support bubble. Where possible, you should try to. Right, so again, this Freedom Day isn't Freedom Day. Meet outside rather than inside where possible. Keep 2 meters apart from people keep 2 meters apart from people that you do not live with, unless you have formed a support bubble with them. That's right. All the players in the football must have their own support bubble. This includes friends and family you don't live with. Minimise travel in and out of affected areas. So if there's any areas that I've listed above, you need to avoid those areas. You should also get tested twice a week for free, and isolate if you are positive. Continue to work from home if you can. Refer to local health advice in your area. So get tested twice a week. One person tests twice a week. So do you get a test do you get a second test in the week if you tested positive or not? Because a lot of people that I'm hearing about have got the symptoms, yes, but after a day or two, they seem fine. And they're bouncing around and saying, well, I've got to self-isolate for 10 days. It's not the fact that just because you've been double jabbed, you don't get the virus, because you can get the virus. What the fact is that once you've been double jabbed, you imagine you're immune. You think that you're unstoppable, but you're not. All right? You can still get it. And the thing is, if you do test positive, you've still got to isolate. So even getting double pricked, you've still got to self-isolate. Okay? If you've tested positive. So my question is, it was all about the vax. 18 months ago, they said, once we get the vax, we can return back to normal. But we're still living by these draconian rules. We're still living by these rules that not a lot of people want to live by. You should get tested for COVID-19. This includes arranging to have a PCR test if you have symptoms of COVID, even if your symptoms are mild. Getting regular rapid flow tests if you do not have symptoms or coronavirus. They're doing that in schools, rapid flow testing. Lateral flow testing. They're doing that in schools. They're saying I get an email every other day. If your child is, testing for COVID, then, make sure they're still doing it twice a week. No, one, I'm sorry. My child's not ill. He's not getting any symptoms, so no, I won't do that. I'm sorry, I won't do it just to drive your numbers up, but it's not going to happen. Arranging testing or managing quarantine package if you plan to travel overseas. You can see further details for this. You should self-isolate immediately if you have symptoms or a positive test result for COVID-19. There is financial support if you're off work because of coronavirus. You can click on that yourself. Face coverings. You must wear face coverings in many indoor settings such as shops and places of worship and on public transport, unless you are exempt or have reasonable excuse. This is law. Right, I'm going to click on the face covering because there was a question on this. I'm going to click on face coverings, when to wear one, exemptions, and how you can make your own. What is a face covering? I'm not going to go into that for you because we all know what a face covering is. Cloth face coverings and disposable face coverings work best. Multiple layers, at least 2. The contents of this face covering is something which is safely covers the nose and mouth. So this, again, the face covering is a bit of a joke, really, because there are many, many people out there that are wearing these face coverings, but it's not covering their nose. You know, people have developed this habit. I don't know what the habit's called, but it's this. They're constantly doing this. And it's like, well, just pinch at the nose, it might stop it dropping down, or, you know, just don't wear them. Just claim yourself exempt. Aha! Ha 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 ha. Face covering should be made of a material that you find comfortable and breathable, such as cotton. Bandanas or religious garments may be used, but are likely to be less effective if they do not fit securely around the face. So you just got to cover your face. So you can have, you know, a bit of mesh if you want. Face coverings are not classified as PPE, which is used in limited number of settings to protect wearers against hazardous risk. Face coverings are instead largely intended to protect others. So you're wearing a face covering to protect me. Look, I'm not bothered. If you wish to find out more about, face visor shields and transparent. I'm not going to bother with that because they're pointless. When to wear face coverings. Guys, there's a list. So nothing's really changed in regards to face coverings. Your face coverings are remaining. You know, it's that simple. Enforcement measures for failing to comply with the law. Premises where face coverings are required should take reasonable steps to promote compliance with the law. The police can take measures if members of the public do not comply with this law without a valid exemption, or transport operators can deny access to their public transport service if passengers are not wearing face coverings, or direct them to wear one or leave the service. So, if you are an exempt person from wearing a face covering, the police can have a chat with you, but if you're exempt, you're exempt. Transport places can actually stop you from getting onto their public transport if you do not have a face covering. You can get fined. In necessary transport for London, not bothered about London. Yeah, after the first offence, there will be no discount. For example, receiving a second fine will amount to £400, and a third fine up to £800, up to a maximum of £6,400 for not wearing a piece of cloth. Bad. When you don't need to wear face coverings, in settings where face coverings are required in England, there may be some circumstances where people may not be able to wear a face covering. Please be mindful and respectful of such circumstances. Some people are less able to wear face coverings, and the reasons for this may not be visible to others. A lot of places need to read those first four lines, sorry. They need to study up on this stuff. This includes, but not limited to, children under the age of 11. Public Health England does not recommend face coverings for children under the age of 3 for health and safety reasons. Good luck putting a face mask on a kid that's 4, 5, 6, 7, 8, 9 years old, okay? Particularly the 4 to 5 year olds. Now, I heard that they were on about face coverings for 3-year-olds. Whether that's true or not, I've got no idea, so don't quote me on that. But, you know, get them to keep a hat on in the sun. They take things off. You can't do it. And if you go on a holiday with a child and you're insisted to wear a face covering, good luck with that. Kids don't sit still on planes. Kids don't sit still anywhere, particularly at that age. And they will not wear the face mask. People who cannot put on, wear or remove a face covering because of physical or mental illness or impairment or disability. So if you can physically not put on or remove a face mask, you don't have to wear one. If you have a physical or mental illness or impairment or disability. Now again, the mental illness is a hidden disability. So if you are watching this, please be mindful. If you are speaking or providing a service to someone who relies on lip reading, clear sound or facial expression to communicate, to avoid harm or injury, or the risk of harm or injury to prevent yourself or others, including if you would negatively impact on your ability to exercise or participate in strenuous activity. Me wearing a face mask does affect my ability to maintain composure. Police officers and other emergency workers, given this may interfere with their ability to serve the public. So this is where you don't need to wear one. Other scenarios, if asked to do so in a bank, building site or post office for identification, so you can remove it then. I remember there was times before where you weren't allowed to wear a motorbike helmet in places. You had to walk into a petrol station and have your face seen. Now they're saying, go in like an armed robber, it's perfectly fine. If asked to do so by shop staff or relevant employees, or identification for assessing health recommendations, for example, by a pharmacist, or for age identification purposes, including where buying age-restricted products such as alcohol. So if you walk into a pub and you've not got a face mask on, you can take it off if they want to ID you. If required in order to receive treatment or services, for example, when getting a facial. Well, if you're getting a facial with a mask on, you shouldn't be getting a facial, should you? Stupid. In order to take medication, obvs. If you are delivering a sermon or prayer in a place of worship, if you are the person's getting married in a relevant place, if you are undertaking exercise or activity and it would negatively impact your ability to do so, if you are an elite sports person, professional dancer or referee acting in the course of your employment. So this is why the footballers did not have to wear face coverings, because they are an elite sports person. When seated to eat or drink in a hospitality premises such as a pub, bar, restaurant or cafe, you must put a face covering back on once you have finished eating and drinking. So again, your freedom day is not really freedom day. Now, exemption. I'm probably going to finish with the exemption. Exemption for face coverings. If you have an age, health or disability reason for not wearing face coverings, you do not routinely need to show any written evidence of this. You can't get written evidence. You can't get written evidence from a doctor. Okay? So you can't get written evidence. You do not need to show an exemption card, so you don't have to prove you are exempt. Your word has to be bond. Your word has to be, that's it. This means that you do not need to seek advice or request a letter from a medical professional about your reason for not wearing face coverings. I'll read that one again. You do not need to seek advice or request a letter from a medical professional about your reasons for not wearing a face covering. So what that basically means is like I just said before, if you tell somebody you're exempt, they have to accept that. They have to accept that. Failure to do so, they're in breach of these terms. They're in breach of the government guidelines. Now, if you're going to follow government guidelines for face coverings and COVID, etc., you must follow government guidelines that say that you don't have to follow government guidelines. However, some people may feel more comfortable showing something that says they do not have to wear a face covering. Okay, fair enough. This could be in the form of an exemption card, badge, or even a homemade sign. This hasn't changed, by the way. This hasn't changed throughout the whole pandemic. This has always been there. Carrying an exemption card or badge is a personal choice and is not required by law. If you wish to use an exemption card or badge, you can download exemption card templates. You can print these yourself or show them on your mobile device. Please note the government is not able to provide physical exemption cards or badges. So the government cannot give you these. You have to download them. Okay, so you're pretty much on your own when it comes to this. So you can download something that you can put on your phone. You can print these off. I've actually got them. But you can download them yourself. Just download it to your phone, take a screenshot, that's it. Somebody wants you to know, you ain't got to just show it. I would also, if you are worried about face coverings, is go to this site and just screenshot exemption cards just from gov.uk. The reads for face coverings, how to wear a face covering, I'm not going to go into that. Face coverings at work, I'm not going to go into that. I'll back up and I'll just see what else there is in this. Where are we? Keeping yourself and others safe, face covering, If you are clinically extremely vulnerable, hi mate, you okay? Yes, I am okay. Hi mate. If you are clinically extremely vulnerable, if you have been vaccinated against COVID-19, to help protect yourself and your friends, family and community, you should continue to follow the guidance on this page, even if you've been vaccinated against COVID-19. So which part of last year, when it was it's all about the vax, all about the vax, all about the vax, once we get the vax, we'll go back to normal, we'll go back to freedom, we'll go back to not having any rules, no regulations, They all said face coverings were going to be removed as of Monday. That's not the case. You still have to follow these rules. So you're getting vaccinated, but you still have to follow these rules. You're only getting vaccinated, the majority are only getting vaccinated so they can go back to normal life. No, I'm sorry. You're getting vaccinated and you still have to follow these rules. You are not exempt from any of these rules. The vaccines have been shown to reduce the likelihood of severe illness in most people. Like all medicines, no vaccine is completely effective, which is really, really bad because the media are promoting full effectiveness, whereas the government are saying it's not full effectiveness. So those who have received the vaccine should continue to take recommended precautions to avoid infection. So again, you're still living under the laws and the rules and the regulations. Whilst emerging evidence suggests vaccines have an impact on transmission, we do not know by how much the vaccine stops COVID-19 from spreading. Even if you've been vaccinated, you could still spread COVID-19 to others, even if you do not display symptoms. How can you prove that? You can't prove that. Getting tested, meeting family and friends indoors, meeting friends indoors, rule of six. Rule of six still in a group of up to 6 from number of households. Children count as the children of all ages count towards the 6. So the rule of 6 still applies in group. So this is if you're in a support bubble where you can meet indoors, when you can meet. So the rules haven't really changed. They're still going to remain the same. The only rule that I think has actually changed is no table service in a pub. That's it. It doesn't even say that. Doesn't even say that. It's not even on here. Let me see if I can find it anywhere. Universities, going to work, support bubbles, meeting friends, place of worship. Pub, place of worship for some people. If you break the rules, it doesn't even say what's happening in the hospitality industry. So, this is basically what you can and can't do as of Monday, which nothing's changed. Absolutely nothing has changed. You're right. The only thing that is going to change is there's no table service in pubs. That's it. That's what I'm reading here. I don't know if you guys have got anything else you want to sort of throw out there, but that's all I'm reading is just table service in pubs is going to be null and void. So you can stand at the bar, still got to wear masks and stuff. Nothing's changed. Nothing's changed. But again, if you've had both jabs, and you've got to bear this in mind when the COVID passport comes in, because no doubt I'll do a live on that soon. You may have been jabbed twice, you may have been jabbed 5 times, but you can still contract and transmit COVID. So don't dare ask me for a passport when these passports come out, because it won't wash. I'm sorry, But don't look me in the eye and say sorry, but you can't come in here because you've not had double jabs. Well, you've had double jabs, and you still got COVID. I know people that have had it. I've heard stories of households of 5. I think it's probably 5 or 5. Probably I'll say 5 people for argument's sake, and 2 of them in the household have actually tested positive for COVID. One of them's been double jabbed, and still tested positive for COVID. The rest of the household negative tests. Hang on a minute. You know what I mean? So, people that are getting double jabbed are still... I had the track and trace on my phone. Only ever go to work or go out with my wife. Got a ping today telling me to self-isolate, but the wife never. And nobody at work is self-isolating to the... Steve, it's a mystery to me as well, dude. I know I've been in contact with people that have got COVID, and I've done track and trace, but not been pinged. So it's like, hang on a second. And then the other thing is, these little pieces of paper that you fill out. When you fill out these pieces of paper, for example, going to the pub, who's calling these people up saying, "Oh, you've been in contact with me, I've contracted COVID"? Do you know what I mean? Or sending a letter. How long's a letter take? It's not the double jab. It's not the double jabber's fault. It's the person who has gone out knowingly with COVID. Mindy Saw said this, and I agree. So I'm going to throw this in. It's the person who has knowingly gone out there, and this has probably happened during the England matches or wherever it might have been. It's the person who's knowingly gone out there with, whether they're tested positive or not, or let's say they're tested positive for COVID, and they've gone out there knowing they've tested positive. It's them that's passed it on. Or whether they've got symptoms, they're feeling ill, and they think, "Do you know what, I'm going to go out about my day." They're the ones passing this on. And they're the ones that are hindering other people that don't really deserve to get this stuff. Nobody deserves to get it. But what I mean is, if you've been double jabbed, and somebody's passed it on to you through ignorance, that's not your fault. You've abided by the rules. You've had 2 jabs. You've abided by the rules. You've done what you felt you needed to do to stay safe, but yet you contracted it by somebody. So you as the double jabber is not at fault. The person, the inconsiderate person, they're the people at fault that have passed it on to you. Okay? It is a crazy system, Steve. It's, can't fathom it. Can't fathom it, dude. I wasn't going to mention your name, Joe, but as soon as you're watching, you've come out there. No, it's not your fault. It's. I've gone a bit embarrassed now. I didn't realise you were watching, Joe. No, it's not. It's the inconsiderate person that's come in and knowing that they've got it or they've displayed symptoms, and they've passed it on to you. That's they're at fault then. Why? Just so they could probably watch the England game. That's wrong. That's totally wrong. And this is what the government's saying about using your discretion. The government is trusting people. Well, sort of. The government's trusting people to use their discretion. To be grown up about this sort of stuff, and not be immature and say, "Well, I've got a bit of a sniffle, and I'm displaying symptoms." But do you know what? And I'll pick on you now, Joe, 'cause you said it. And you know what? I'm gonna go to a pub anyway. I'm gonna go there anyway. No. I'm sorry, but you're at fault there. You're at fault. You've passed it on to somebody. But again, that kind of does contradict the double jab, which then says, right, okay, I've had 2 jabs. You feel in yourself that you are safe, but then you contract it anyway. And I wasn't just talking about you, Joe. There's other people that I know of. But because you come on, I'll mention your name. There's other people that I know of that just because they've had 2 jabs, they're still contracting it. And if they're contracting it, they're also transmitting it. Okay? They can transmit it. But what these people cannot do is then say to me in August time, "We need a passport." Because hang on a second. There's a contradiction there. And this is where the government's, and again, this isn't the person's fault that's asking for the passport. This is the government's fault. This comes down to what the government are expecting people to do. Because there's going to be people out there like me, they're going to be like, hang on a second. How is that okay, but this isn't? How is that all right, but this isn't? You know, how can you do this, but then I'm not allowed to do this? Do you know what I mean? So you know, there's going to be a massive contradiction. There's going to be uproar. There's going to be some uproar in this. You know, and again, when the passport does come up, this is just another freedom. This is another freedom being taken by the being taken off us. What they do is, you know, I'll go back to the constrictor effect, and I'll probably do a live on the constrictor effect in more detail. But they've let us out of our box. They give us some space, but then they put us back in our box a little bit, and then they let us out a little. Whilst we're in our box, the box that we were in before has got smaller. So even though we might have gone from this size here box to, all right, we're back in our box now, we've been let out. So the box just gets smaller and smaller and smaller, and it won't be over until we're all put in our little boxes, until we're all put in our little cages, and we are confined. Okay, the confinement does affect people's ability to live. You know, if you know husbands and wives living together, you know, in confinement, there's going to be something there that's going to kick off. There's going to be something there that's going to. I'm going to turn the camera around. I'm not really.
Why are you such a...
Such a dick. There's going to be something there that's going to kick off, you know. So this, your box won't be so little. Well, no, because I'm a big lad. Big lad. Just ask me for a passport, Joe. So the box is going to get smaller and smaller and smaller until we're just confined in our own boxes. So that's the constrictor effect. The constrictor effect is they give so much, they take it away. They give a little bit back, they take it away. So eventually, we end up like you know, a country that I won't say what name it is, but right now we've got a lot of freedoms, even though it might not seem so. But we have got a lot of freedoms. There are countries out there that have got zero freedoms, and I mean, unless you are a person of importance, you're not allowed to drive a car. You know, where you know there's only 16 hairstyles allowed in the country. I think it's 10 for women and 6 for men. But the person who runs that country, their hairstyle's not on it. So it's like, hang on a minute. Do you know what I mean? Hairstyles don't bother me anyway. So yeah, you know, the rules haven't changed. The rules are going to remain the same. The only thing, like my friend has said, I'll call you my friend, whether you are or you aren't, I don't know, has said earlier, is that the only thing that's changed is no table service. You go to the bar to get your pint. So what's Freedom Day all about? Look, just to finish off with, this is going to get, it's going to get worse, okay? Rights are going to be limited. Freedom's going to be limited. I believe in freedom of speech. I believe in freedom of expression. I don't like hate speech, so, you know, I don't like that sort of stuff. So freedom of speech is... Hate speech isn't freedom of speech. Hate speech is just hate speech. But freedom of speech is you know, I do like that. So you got to make sure... All right, Leon. So you got to make sure that you are acting accordingly. But like I say, you know, it's going to get worse before it gets better. And I can't really see it getting better. A lot of the things that I've been saying over the last 18 months are happening. You know, I've been mocked for saying them, but they are happening. And they've happened. So it's like, hang on a second. So they're probably... I'm kind of thinking there's going to be a fourth lockdown. They've allowed all these people to, you know, they've kind of bringing us out of this lockdown, as it were. I mean, it's not really a lockdown because we're not really locked down. It will, but just think you can get served yourself at the bar. Yeah, of course I can. Told you, Joe, I'm propping my stool up at the end of that bar, man. I've missed it. Taking my stool away. So yeah, it's going to get worse. There probably will be a fourth lockdown. Cheers for the shout out, mate. It's all right, Leon. We need to have a chat, me and you do. We'll have a chat later. You know exactly why. So yeah, look, it's you've got to. What was I going to say? Yeah, there's probably going to be a fourth lockdown. I don't want them to be, but there probably will be. The Delta variant is the big variant right now, and that's what's being sold. So there's a lot of sales happening in this COVID-19 thing. There's a lot of media coverage. I don't believe, and this is just my opinion. This isn't fact. I don't believe that that a pandemic needs this much publicity. I also don't understand why COVID vaccine centres and test sites are so secretive. What is going on there that can't be recorded? You know, you're on public grounds, but because you put a fence around it, it makes it private. Okay, so if it's private, does that mean that, you know, there's money being made? You know, that's a question. Is the money being made? And apparently, the doctors don't get their 12 quid per vax until you've got the second vax. From what I've read, there is something that I do want to read to you. I did say I was going to finish. There is something that I do want to read that I was sent. I'll probably do another live on that. Or can I do this? Can I do this now? Can't do it. Can't do it, peoples. Sorry. It's from the government website. It's from the government website, and it's saying that there's going to be an influx of the variant, and the people that are going to suffer the most are going to be the double vaxxed. Okay, from the government website. So the people that are going to actually suffer from this and the hospitalisation things are going to be from the double vaxxed. So just I've shared it on my Facebook anyway. So if you haven't seen it, or what I might do is I might use it as a thumbnail in another video. So if you haven't seen it, then have a read of it. That's directly from gov.uk. All right. So yeah, directly from gov.uk. No, I can't get on. I've got to use my camera to get onto the computer, WhatsApp. So yeah, have a look. I'll repost it. I'll put it in the comments in this feed. All right, so that's it, peoples. I'm out. It's been a pleasant evening with you all. Thanks for watching. Thanks for commenting. Thanks for your feedback. Thanks for not taking anything I say too offensive. If you've taken offence to it, not really bothered. It's my opinion. Look, guys, go on to the Bearded Opinion, please. Get onto the Bearded Opinion. Give it a like. Give it a subscription. Something. What is it? A Drum and Cymbals live night tonight. Am I on the big screen? Is the question. So yeah, get onto the Bearded Opinion. Just subscribe, guys. There's only 4 subscribers on there, but there are like 670 views per video. So it's like, well, why have you not subscribed? Subscribe to it. I'm gonna try and put more content out there. Can't go live with that because of the obvious Spinny. Because of the obvious not enough subscribers. I do want to do other videos and other things. Like I said, the other channel was YouTube got rid of it. They've totally deleted me. So there's a lot of content there that I probably need to redo, which some of it won't be live, some of it will be. So a lot of things that I've said before, I'll probably go live on again, and just upload it to the channel, just for content, really, just for videos. Hello, missus. Hello. So go to the Bearded Opinion. The Bearded Opinion. It's basically, it's this. It's not a picture of me, don't worry. It's just it's something I downloaded with an exclamation mark, because basically every video is going to end with, and that's the Bearded Opinion. So get on there, please. I'm begging you to give it just a subscription. You don't have to get notifications, but just give it a subscription for YouTube. Please, 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 please. You don't have to like everything. You can dislike it. Freedom of speech is welcomed. Freedom of expression is welcomed. Hate speech is blocked. And that's hate speech, calling me names. That's blocked. I'll let you have your say for so long, and then, all right. So I'm going to love you and leave you. Everything I've said in this video, that's the bearded opinion.